Hey everyone, this is Dr. Arjun, and welcome back to my channel. Today we have the second episode of regarding this is a health related topic, and today we will cover new topic that is basically a very hot topic in cancer treatment. And as you know, I am Dr. Arjun Singh. I am a specialist in especially in medical oncology department, which deal in the all kind of medicine in cancer treatment. And so here we are in the next episode of this health awareness. Basically, what is immunotherapy? And everyone is curious about what is immunotherapy, how it works, and what are the effect and side effect to the patient who are undergoing with immunotherapy, and what are the prospects we have immunotherapy. And And so, what is before the immunotherapy? It is basically better to understand what is the cancer. And if you see cancer is a disease in which some of the body cells grow uncontrolled and spread to other parts of the body. As we know, there is always check in the cell growth, but in cancer type, there is an unchecked growth in the body, and that will lead to the growth, abnormal growth, which is called malignancy. And what is the causative factor? If we see cause for this cancer, which documented cause. We have the multiple causes, but common causes chemical, toxin, compound exposure, ionizing radiations, and some pathogens. And most cancer from tumors, but not all tumors are cancers. This is a very important thing to understand to everyone, to my general public, that most cancer from tumors. Tumors grow in cancer, but not all tumors are cancerous. And with this, what kind of management we have in cancer? You can clearly see in this slide. This is a beautiful slide. This is one is surgery. One is a more important part of treatment. Second part is also radiation therapy and chemotherapy, which is expertise I'm in this field. And recently we have immunotherapy, which is included that in management of cancer, with hormone therapy, target therapy, and stem cell therapy. From chemotherapy up to the stem cell therapy, all given by the as a professional, as a medical oncologist, or as a cancer specialist, only specifically medical oncologist, because these are all medicine related to the cancer treatment. And this radiation therapy was given by the radiation oncologist, which is another branch of cancer treatment, and surgery is a different branch. And it is an immunotherapy we are discussing today, immunotherapy, and what are types of immunotherapy we have in cancer these days. So clearly we can see what kind of immunotherapy we have, which is immune checkpoint inhibitor (ICP). Mostly we can set it for ICP. Immune checkpoint inhibitor like pembrolizumab, ipilimumab, nivolumab. We have this immune checkpoint T cell transfer therapy. This is treatment of boost natural ability to your T cells fight cancer. This is we transfer the T cells which are helping to fight the cancer. One is monoclonal antibodies. We're using monoclonal antibodies, a type of immunotherapy. Immune system modulator, we're using immune system modulator, and treatment vaccines, we also vaccine, which are increase the immunity. All the things are related to immunity of the body. And how this work, and in later slide, you will see this. So in this slide, what is immunotherapy? Uh, Immunotherapy is a type of biological therapy for cancer treatment that helps the immune system fight cancer. Basically, we have the immune system which is balanced between the one is a pro immune system. There is immune system body in which there are two components. One component is there which help in the fight the uh, which suppress the immunity, and one other which is increase the immunity. And we have the balance in the body. But immunotherapy basically do increase the immunity in the body toward the cancer cells. And how does it work? Stimulate on immune system to work harder or smarter to attack cancer cells. Basically, once there is a growth in cancer cells, there is a decrease in immunity against the cancer cells. And we do what we do, we uncheck our immune system toward the cancer. So we put it in the on mode so that it act again on the cancer cells, abnormal cell, which is cancer cells. So in that, it will help to fight the cancer. So basically, if you see immune system in the body, what is the immune system? It is external immune system. What we have is like skin, mucous membrane, and nasal hair. This is external barriers. This hair is also barriers. And internal, what is the biological? We have barriers with the first line defense and second line defense. And first line defense, we have the phagocytes uh, and natural killer cell. These are the first line defense toward anything abnormal in the body. And this is called innate immunity. And the second line defense, we have T cell and B cell. Usually, this is a professional words, but that's if major. If in the broader way we can say we have the immune system in the body, which is the external, internal. Internal, we have the cells, and external, we have the mucous membrane. And so how it act, it is a little bit complex diagram for anyone, but these are two types of cells which help in the activation of immune system. One is antigen presenting cell, and other is cancer cells. In both, it is a PD-L1 and PD-1 receptors on the both segment. And with this is a checkpoint inhibitor, checkpoint one. This is CTLA4, which is a as in the previous slide we have seen, this is a T cells and regulator cells and T cells. In T cell, this is CTLA4, and in cancer cell we have the PD-L1, and this is checkpoint two. Checkpoint 2 PD-L1 combination. Checkpoint 1 is CTLA4. CTLA4 mostly on the T cells, and the checkpoint 2, this is mostly on cancer and T cells. And mechanism action of the immune checkpoint inhibitors. What is the basically, this is a slide which I think as a professional we should know a little bit more, but not for general public. This is immune system. This is body system. What we do basically, this is basically this is a CD3028, CD80, and CTLA4. In cancer cell, there is a decrease because this is suppress this. This will suppress the immune system of the body. And in cancer cell, there is an increase in growth of this CTLA4. If there is increase in growth, the immune system will be suppressed to the cancer cell. What will we do? We do with the CTLA4 inhibitor, ipilimumab, tremelimumab. With this we deactivate this, and with this, we have the increased immunity toward the cancer cell. Another is a PD-L1 and PD-1. Again, we have the in cancer cell, there is a decrease, there is an increase in the PD-1, so that there is a cancer cell immune to the immune toward the immunotherapy of the body. So what we do immunotherapy, and immunotherapy will inhibit this PD-1 or PD-L1. There's two types of PD-1 and PD-L1. PD-1 for basically inhibitor nivolumab, and PD-L1 inhibitor pembrolizumab. We have a lot of drugs on this, lot of drug added every monthly, every yearly. And so basically what we do we suppress the level of CTLA4 and PD-1. We suppress these levels. With the suppression of this level, the immune system of the body will again act toward the cells which is abnormal, and this time this is a cancer cell. So with this mechanism, there is our own body to act now toward the cancer cells, and with this we will fight toward the cancers. This is basically this is the scientists which have published this. This is a put on research paper on this. Got the Nobel Prize on this in 2016-17 literature. These are two scientists, one is Japanese, one is the American scientist, which have got Nobel Prize for this immunotherapy. And now we have this is a beautifully picture again. We have seen this is a T cells, and this is a antigen presenting a tumor cell. This is activity T cell. There is a markers which are activating on this, and with this we fight toward the cancer cells. And how is immunotherapy is given? It is very important question to general public. How it is given? It is a different kind of. It is immunotherapy can be given IV, oral, topical, and intravesical. But most commonly we're using the intravesical injectables. And what is if you see in this picture, in this pic, there's a timeline of immunotherapy, and look at we started in 1980 from the base. We have to start in 1980 CTLA4 CAR T cell, and now we 2022 23 we have achieved so many of the recently added so many drugs. And for me, when I started the residency in 2016, this is the first time we are using the immunotherapy like nivolumab. We have the 16 used in Delhi NCR in this Medanta Institute. 16 we have started with immunotherapy. Before that we are doing approval, but in 16 we have approval for the nivolumab. Then we added so many drugs within next 4 to 5 years. Now this is a trend right now. In every drug we have the immunotherapy, the first line category, especially in metastatic stage 4. And now we have recently data about the stage 1, 2, 3 also immunotherapy data, but there is no any clear-cut evidence on that. But yes, but stage 4, there is a lot of data coming up with here. With the beauty of immunotherapy is that if first of all, we should know the response rate is not always is 100%. If we use immunotherapy, it is on tumor marker based. We are using this, and first marker should be positive, and if they are positive, the response should be very high, up to 60 to 70. But good thing is that the overall duration of response is prolonged. It's not 1, 6, 7 months like immunotherapy. It is up to 2 year, 3 year, 4 year also we are going on. But two things are which are not good at all. Another thing is that we just cons of the immunotherapy is that the cost is very high. If you see the immunotherapy cost is very high, including in US also, including in Europe, including in India also, in Asian countries also, the cost is very high. And we know that resources are not infinite. The resources are limited to everywhere in the world. And so, with like trend, we are seeing, looking the immunotherapy in the world, the increase in and expected by 2050, maybe we are in the trillion of budget we require for immunotherapy patient. But this is the way we're doing that. I hope in future we have a lot of drugs, we have a lot of generic drugs also. We don't have patent for this, so that generally public will be benefited from this dreadful condition that like carcinoma, cancer, and this is the only pros and cons we have discussed. And mother cons is that a lot of people have a thought they don't have a side effect. They don't have any sort of, yes, I totally agree. They have side effect, but we never say this. They don't have any side effect. Yes, they have lot of side effect. It depends on how do you handle it, how do you manage it, how do you diagnose it. Like from nail, from the hair follicle up to toe, we have the all kinds of like if it's a major side effect, fatigue, headache, arthralgia, chills, rash, diarrhea, colitis, hepatitis, infusion reactions, endocrinopathies, we have pneumonitis, we have anemia, we have everything we have. It's not without side effect. And how to manage is very important thing is that it is an important grade 1, grade 2 usually manage easily, but grade 3, grade 4 pneumonitis or hepatitis, endocrinitis, which is serious like organ damage, lung, pneumonitis, lung, renal, this colon, this liver, this is infusion reaction. We have to initiate these drugs which are in like steroid or other things. Better, what is my advice? If anyone is your in family and immunotherapy and he is facing a lot of side effects, just consult your treating doctor so that he can advise you, guide you what which step will be taken. And for me, I'm using this immunotherapy last 4 to 5 years. The most common side effect I'm facing these days, last 4 to 5 years, this is basically worsening of the thyroid functions, and another is the skin rash. And these are managed very easily with the recent drugs. And with this, I think I can say this is my second series on the health topic, because I'm from the one channel I'm doing both things together. One is a health related and one is a wealth related. And I hope you have today video you have a little bit you have gained information regarding immunotherapy, and if you think this is relevant to this will add some relevant to your life, so please like it, share it, and subscribe it more and more, and many, because this is two content I'm putting on this one channel. One is health related, one is the wealth related. Wealth is I'm doing the weekly update, but in health I'm doing 1 or 2 monthly one topic. And please comment me if you want any health related, any, especially I am the cancer specialist, like a medical oncologist, any videos, any content, anything on medical oncology point of view, on cancer treatment point of view, so that I put on that, so that general public will be aware of that. With this, I'm signing off from this this health related episode, and will catch you another another thing, that is a weekly market update, which I'm putting in every week. And till then, take care. Bye.